Welcome, everyone, to Exploring the Elements and Interconnectedness of Our Local Food Systems. We are hosting this webinar, Jerry Hush and I, Maria Papitas, and we're both from the University of Delaware Cooperative Extension. And so welcome. Thank you for being here. You all saw the registration, and I guess we're curious about our regional food system and how it all is interconnected and how it works together. So during our Monday sessions over the next couple of months, actually, we are going to be exploring those linkages between food production and its impact on health, on the environment, on our communities, on our economies, and primarily in the region. Sort of Delaware and Maryland, because we work a lot together, our two states. And we're hoping that we're going to be offering some insights into kind of what we learned from the disruptions during COVID and the pandemic. So some people might really be curious about how we even got to doing this, this webinar series. And you may or may not know, but back in April of 2021, Cooperative Extension, both the University of Maryland Cooperative Extension and the University of Delaware Cooperative Extension, and a team from the Extension Foundation, which is a national organization, co-hosted a forum that brought kind of decision makers together, people who wanted to kind of better understand our food system and tackle some tasks. And the name of the forum was, Could COVID-19 Disruption Happen Again? Working Collectively to Build Resilience Across Our Food and Farm Systems on the Eastern Shore. And so as part of that forum, attendees learned about what was happening in terms of our food system and the disruptions that we were trying to manage. And then also kind of identified resources that could be used to impact some of those disruptions. And there were teams that were put together, and those teams were tasked with coming up with what we called a big, easy idea. And so one of the teams said, we should do a webinar series and also make some resources available for those people out in the community who wanted to learn more. And as we discussed it some more and kind of brainstormed about how we might do that and who were the target audience, it became clear that it wasn't just consumers that are confused or concerned. It was also professionals, in that oftentimes we get very focused on the topic that we know most about and don't necessarily know about the other parts. And so people were really excited about learning about other parts of our food system. So overall, we're hoping that as a result of you attending today, that you'll have, or actually over the series, you'll have a better understanding of how health, heritage, economy, and our communities across Delaware and Maryland Peninsula are really interrelated with our food system, our local food system. We hope that you better understand the characteristics of our particular food production, preparation and distribution systems, and how it relates to access to healthy food and really, as you're going to learn today, health. Our ability to identify some of the opportunities and challenges that we can use to strengthen our food system, and also some practical, like how might you get involved? So I wanted to share this diagram because it's simple, but it's complex. And it's a nice tool that all of our presenters will be using over the next couple of months to kind of show where their piece is in this lovely depiction of a food system map. And obviously, as you look at this, this is a system, but even within this system, there are many systems, as we're going to learn about. And so, one of the things that you will hopefully learn is that a region's resources, policies, and participants in our food system are different than those in other regions. And so our location affords us a nice variety of food, including seafood. And we get to be close to the ocean. We have relatively good weather, although some farmers might argue with us on that one. We have fertile land and supportive policies. Locally, we have lots of people. And so if you think about other places in the country or other places in the world, their food system is going to look very different. And so, but even within our little region, our geographic region, there are differences in the environment, in the soils, in our health, in agriculture. And so that makes our system unique. And so that's really what our series is about, learning a little bit more about our unique food system. So I would be remiss if I didn't thank our supporters and cooperators. And so here is a list, and you can see it's folks within agriculture, it's folks within health, it's folks within the university systems. And so we're really pleased to be working all together to provide good, solid, reliable, trustworthy information about the topics that will be presented over the next few months. And so today I have the pleasure of introducing Rita Landgraf. And she is going to be talking about healthy foods equals healthy people, communities, and economies, and kind of provide an overview of our complex nature of our food system in Delaware and Maryland. And so, Rita, I am so pleased to have you here. You bring such a wealth of knowledge and caring and understanding around the people side of our food system. And so Rita is officially a professor and the director of the Partnership for Healthy Communities, and is a member of our University of Delaware Department of Behavioral and Nutritional Health.
Thank you so much, Maria. And it's great to be with you on Monday and kicking off this series. And thank you all for joining us. I don't have to tell you the value of our food system and what it brings to our communities. And I'm going to lay the framework. And what I want you to keen in on and really lean in hard is how our food system does interact with our overall health and well-being system, but also the haves and the have-nots. And what does that mean when we think about access to our overall food system? Now, who am I? What do I do? How did I get here? My background largely is in disability and aging. Most of my career has been geared towards individuals who have found themselves marginalized, and largely our disability and our aging community. So when I think about the whole food system network, those two communities as well, many times are on the have-not side of things relative to healthy nutrition, relative to access, relative to engagement. Through my work as an advocate and an activist, it actually allowed me the great honor of being the cabinet secretary under Governor Jack Markell here in Delaware for the Delaware Department of Health and Social Services, which also plays such a critical role relative to our food system. And I was in that role from 2009 until early 2017, when I had the opportunity to come to the University of Delaware under the Community Engagement Initiative. And I I lead the Partnership for Healthy Communities with a special focus on Delaware communities, and also with a special focus on looking at Delaware data and leaning in hard on the communities within Delaware that have very poor health outcomes and have very large inequities in overall health. As Maria said, I also have the honor of being in the College of Health Sciences and faculty there as well. Today, I want to lean in on the role with the Partnership for Healthy Communities and why my topic is so critically important when we think about the food system of today, and when we seriously think about how do we get more intentional to advance this food system for tomorrow. So when I think about a healthy community, you may have heard this relative to what are the social determinants of health, but the inner circle is how do we think of a healthy community? And many times when we think of health, we think of clinical, medical, but health is so much broader than that. And the little circles around that inner circle really focus on what is required to support a healthy community. And food is a big piece of that. If we were to even drill into our physical built environment, public transportation, when we think about how food is transported, when we think about the built footprint and the role of the built footprint in enabling access to healthy food and actually growing food, all of that is at a place-based level. Another way to think of this, and I just shared this with you, for far too long, we've been calling these things the social determinants of health, but really what they are what are the vital conditions? What are the vital conditions to promote overall health and well-being? And as a society, even from a global perspective, really what we want for all people are to live in places that are thriving. But we know today that that doesn't occur. It doesn't occur in Delaware, in Maryland at a local level. And we know it doesn't even occur at a global level. When you look at the vital conditions framework, food falls under what we need for as a basic need for overall health and well-being. So again, you will be seeing, I believe, a transition from what we traditionally have called social determinants of health from actually a federal government perspective to think of them more from what are those vital conditions that are needed. But to simply put this, it's really about what surrounds us actually shapes us. So health begins where we live, learn, work, pray, and play. And are all of us on a level playing field? Do we all start at the same place? Nico Brady actually uses this framing, and I really appreciate it relative to the intersection between public health and agriculture. I think we can look at this intersection also from a food system and public health. When we think about our built environment, that definitely affects our health. The ability to be mobile, active, to readily access healthy foods. On one hand, there are people without access to healthy and fresh food. And on the other hand, we have this vibrant food system, as Maria said, especially in Delaware and Maryland. We have a vibrant system, supply chain, but do all living in these states have that equal and equitable access to engage with this system? And a vision that I think all of us can embrace is a healthy, safe, vibrant community where all people are thriving. So as you go through the series, I want you to think from that lens, and then what strategies can we bring forward to get closer to that vision? So when we look at determinants and vital conditions, why is that so necessary? On the right hand of the slide, according to the World Health Organization, these are the necessary conditions to promote our health and well-being. And I highlighted the food, but not only food access, but food security, access to the production, agriculture, what is the cost, and given voice to those that might not have equal, equitable access. The pie chart more or less demonstrates what makes up our health and well-being. And you see the left side, the genes and biology, many times we blame our DNA if we are unhealthy, but quite honestly, that only represents about 10% of our overall health and well-being. And our clinical is anywhere between 10 to 20%. What really represents our health and well-being is, again, what surrounds us shapes us. 40% is representative of our social and economic factors, and 30% is representative of our health behaviors. And I always caution my students that you have to look at social and economic factors along with the healthy behaviors, because if people do not have access because of their social and economic factors, no desire to change a behavior will actually change it. Access is actually required. So the World Health Organization actually defines health. Health is defined as a state of that complete physical, mental, social well-being, and not merely an absence of disease. It is the opportunity to achieve optimal health. So as you're thinking about this and the series, I want you to think of this one question. Do all people have an equal, equitable opportunity to achieve optimal health? And again, if you say no, which usually when I do this in audiences, people will say no, then what is required for us to change that? And when we think about the interconnectedness of our food system, how do we take that question of all people that the World Health Organization frames having optimal opportunity to achieve health and well-being, how do we intersect that with every level of the interconnectedness of our food system, from the supply to the demand side? So how does this definition actually relate to our food system? Well, food is at the center of many critical public health issues, from hunger to obesity to chronic disease to even climate change. And unhealthy diets in the US contributed to approximately 678,000 deaths each year. And globally, we know the number of overweight and obese adults is rising in nearly every region and every country. And now about 13% of the world's population are considered obese. And so we knew also when the pandemic hit, who was most vulnerable. And we know that there were certain chronic health conditions that really put people in further harm's way. It is all interrelated. Our American adults now have one or more preventable diet-related chronic diseases. And we know that food security and nutrition are increasingly seen as those powerful determinants or vital conditions of health, but yet not framed broadly for us to really consider how do we address this from a policy and a research or a resource perspective. So at the core of many public health issues is indeed our food system and the connection to that social and environmental justice and the disproportionate impact on our marginalized populations at every level of that supply chain. Our most vulnerable populations in the United States suffer mainly then from lack of access to healthy foods and limited spending choices. And they are risking their lives because of it. And this isn't my opinion. This is something that we are seeing more pronounced in schools of public health. And Columbia University, the Mailman School, actually has a whole discipline dedicated to the food system and public health. I also wanted to bring up a study that was done back in 2015 to give perspective relative to focus groups and hearing from people relative to their relationship with our food system. What is the shared understanding of what makes healthy food? There was a strong emphasis on this study with the focus groups that fresh, both in our rural communities and urban communities, were seen as healthy. And that the understanding of healthy food in our communities was shaped not only by an individual's experiences, but also by others in their households. I would also dare to say probably by also it was shaped within their communities. So healthy can be contested and challenged. What I might consider healthy, others may not. And what are the priorities? They do matter to individuals and communities. What about taste? What about cost? What about calories? Well, this man in Baltimore said, well, I know my taste buds and I know the prices, so I can recognize a good price. Monday morning, you get a good deal in there on some meats because they marked it down from Sunday. That goes home with me. You know what I mean? That goes home with me. So cost does matter relative to access. And then this woman from rural Delaware said, I ain't trying to eat all that healthy. So sometimes I do buy something processed because I feel like I'm starving the children. And then the costs and the compromises that people that are challenged, largely individual populations who have been made marginalized, to having access to healthy food, the internal struggles that they share and the external barriers that they are faced with. Well, so when we think of cost, this woman says they charge you like $20 for one little thing that's really healthy and $2 for junk. It's like, which do I go with? And then navigating the food swamp. And I still find healthy food is a journey for me, a journey. I can get a little bit here. I can get a little bit there. And then on the way there, I might pass some fried chicken, and it's hard sometimes. I'll stop and I won't get the healthy food. I'll end up with the fried chicken. It's like if we go into 110th Street, there's that little chicken place right there by that grocery store, and she's from New York City. So the urban focus group stressed how the prevalence of fast food outlets was ever present over stores with fresh foods. In conjunction, what we see in many urban environments, in addition to fast foods, we also see other things like bars, like liquor stores, like all those things that will impact overall health and well-being, chronic disease, empty calories. So indeed, some of our communities are definitely not at a level playing field. And in some instances, the risk factors are enhanced in these environments. And what about that transportation challenge that presents challenges to accessing good food? A lack of transportation, your own car, inconvenient public transportation, that really restricts individuals to where they shop within their neighborhood and what they may be surrounded by. And many times then, they are priced out, even if healthy food is available. And in the rural focus group stressed lack of food retail venues overall in town, especially what they called real grocery stores. And many times, we think, especially in a state like Delaware and Maryland, our rural environments many times is where our agricultural settings are. A lack of food retail venues, again, are critically important. And when we think of little to no access relative to public transportation in rural America, consumers there are also restricted to the smaller stores with less variety and many times less fresh food. So how do we improve access, and what did the focus groups inform us about? The participants did desire more information, but food preparation tips and recipes, selecting healthy and quality foods, again, but what are the challenges if that's not available? Even looking at food safety, which is a very strong public health discipline, the proper storing of food, how do we prevent spoilage? They asked for circulars announcing where sales are for the healthy food, looking at better labeling and signage on products in stores. They observed some information bottlenecks. So it's not like populations resist the information. And this woman talked about thinking about a lot about where her meat comes from. And she even took a nutrition class, and they talked about grass-fed beef. And then then cows that are stuck in a barn all of the time, and that they do not get that grass-fed, and the loss of nutrients. And she indicates it's hard. You can't just walk into a store and say this meat came from a cow that's grass-fed. So she's looking for what more information so that when people do have access, they are picking the healthiest of all. So in that particular focus group study, in recapping those findings, what they shared were lower income residents widely again associated healthy food with fresh. They have a complex understanding and varying priorities around healthy food, so that tension sometimes about what's even available. The external barriers present that internal struggle. And improving food access requires increasing information to consumers, but not just information for information's sake, also addressing what are those structural barriers and how do we mitigate against those. Now, when we thought about what happened, from a pandemic perspective, the World Economic Forum actually started reimagining our food system in a post-COVID world. And at that forum, what they leaned in on was that the pandemic had laid bare the weakness, again, not just in our local food system, not just in our national food system, but this has been experienced globally. And that taking the opportunity now, I love to think of that every crisis does present opportunity. If we would just take advantage of that, what are the opportunities within a crisis? And this one in particular, to rethink the way we produce, distribute, eat food in order to help build a healthier and a more sustainable world. So as you think about this series, and I loved when Maria talked about the group that came before us and looked at the big, easy idea, even creating this series where cross-sector engagement, where we come together and really try to think things through, that diversity of thought typically brings forth the best of solutions. So for us in Delaware and Maryland, how do we rethink the way that we produce, distribute, and eat food in order to better build a healthier and more sustainable world? Again, with the concentration of those that are not at a level playing field already. If we address that population, those populations, all of us benefit. So at the COVID World Economic Forum, they came up with 3 actions to kickstart this change process that I believe this is from the world, but we can take these actions and think of them more locally from a Delaware, Maryland perspective. The first one was just rethinking the supply chain to create a diverse and healthy diet. Food choices do matter. And if humans shifted their diet to, of course, include all the healthy foods, fruits, vegetables, seeds, nuts, fish, whole grains, we would see a reduction in that diet-related disease. Now, remember what I said, and where we see a disproportionate share of individuals impacted by diet-related diseases, and rethinking the supply chain. Because we know, right, that without that level of access, we're seeing these chronic related diseases increasing. And no surprise when COVID hit, the vulnerability of premature death by COVID. But our global food system, and I would dare to say our local one, isn't necessarily built for diverse, healthy diet. 80% of the world's food supply is grain and grain-fed livestock, while fruit, vegetable, pulses, and fish are expensive and much less accessible. So how do we rethink, and what do we need to do to redeploy today's system? And we must redesign with nutrition and human health in mind. And we can begin by supporting local food systems with shorter, fairer, cleaner supply chains that address these local priorities. So if that's what we can do, that's the what. How do we begin factoring that in, not only from our policy perspective, but what does the resources need to look like? And how do we deploy the resources more intentionally to address that? Number 2, they said to build strong connections between environment and food policy. Again, policy creation. And policy is only as good as the paper it's written on as a policy. How do you translate that into practice? And how do you cascade it throughout the entire system? And how do you apply intentional resources in that process? How farmers produce food determines not only the fertility of their souls, but the health of our own planet. So it's even broader, just like that definition of health. The food system of tomorrow and must embrace that one health vision that I know agriculture is so committed to, and advance positive interactions between that human health, that livestock health, that wildlife health, and the entire ecosystem health. This is why public health aligning with agriculture and our food system is critically important. This type of approach can minimize, of course, the spread of disease. It can ensure adequate water for our crops, reduce that flooding and wildfires that we're seeing, drastic shifts right now, over the world, but even here locally, in Delaware and Maryland, and protecting our farmlands from these climate events. So how do we take that recommendation and build that into our local framework? In the year 2021, our global community began to develop a new action framework under the United Nations to advance action under that framework. And food system is a part of that. So the timing is ripe from the world and the United Nations perspective. How do we then utilize that and cascade it locally? And the last recommendation is to strengthen and localize those food systems planning to host transformation holistically. We need to be engaging our policymakers, and we need to facilitate what I call cross-sector planning. Not just the public health officials, not just the agriculture officials, our institutions of higher learning, but also the very voices that you heard from the focus groups. How do we bring everybody together and look at these 3 recommendations and really then look at objectives and again, translate these things into practice from a holistic perspective? So that is our opportunity at a local level. It's as simple as just alignment on these vital conditions, which our food system is. It's increasing the funding and attention in a cross-sector engagement like today to really lean in more intentionally. It's not enough to say someone else will solve this issue for us. We are at a critical stage that we really do need to spend time and prioritize this work. And we must recognize that this will take investments and it will take time, but well worth the effort. So when we think about that, how do we create a pathway to working together from that premise of thriving people and places for all of us? And how do we really look at these investments over a long term and commit to it? The time is now. The disruption of COVID-19 over our 2-year period has really revealed for us the failures of our systems and that they cannot be ignored, and that we require this level of collective capacity to really do things differently and to rethink them and to keep at the forefront who is not at our existing level playing field, and how do we create the strategies to bring forth equality and equity. We call this good stewardship. All of us are stewards in our own right. What we are advancing is taking responsibility to formulate real, intentional, authentic working relationships cross-sector to transform well-being across our region. And then as serving as a natural boundary spanners, because they are informed, really looking at place-based, interdisciplinary, multi-sector, and multicultural perspectives. We learn from the diversity of thought, not in spite of the diversity of thought. And when we come together from that lens, we can create very meaningful, equitable solutions to multiple problems or challenges. And that we must understand that purpose must be larger than just us or just our own sector. Power must be built and distributed with others, and really the value of wealth. Wealth building is very significant in who has access to the overall food system. And if all have the freedom and the support to generate wealth, that will create long-term value, as well as addressing some of these short-term urgent needs. I love this quote. It really resonates with me. I have an inherent belief that the more we take care of the people in our community, the better our economy and our society will be. When we think about the food system, how does that resonate in that value, that belief? Hearing our voice. I wanted to bring that study so you could hear right from the people how they view access and the food system. So I can boil this down to, do you, or maybe even thinking about the US society, does our society believe access to healthy food is a right or a privilege? The USDA definition of food insecurity is a household level economic and social condition of limited or uncertain access to food. Back in 2018, 1 in 9 Americans were food insecure. That represented more than 11 million children. And it's probably growing right here in the United States. Those numbers are rising due to the COVID-19 hardship. And when we look even further, there's a projected 21% of Black individuals, 1 in 5, compared to 11% of white individuals, 1 in 9 in 2021, were food insecure. How do we change that? So when we look at even further the racial disparities, what we see, 1 in 12 white non-Hispanic individuals, 8.1%, lived in food insecure household, compared to 1 in 6 Latino individuals, which is at 16%, 1 in 5 Black non-Hispanic individuals, which is at 19%, and 1 in 4 Native American individuals. So we do see that disparity and inequity. So if we see it, let's think of strategies to rethink and change these statistics. So really it's about advancing towards health equity. Our food system is part of advancing towards health equity. And it benefits all of us because health is a public good necessary for a well-functioning society. So we can move towards that shared stewardship, and you'll be hearing more throughout this series. Again, keeping in mind, how do we redesign in a way that we elevate towards health equity? And in advancing towards health equity, how do we ensure that we institutionalize this in the fabric of our policy development, in the fabric of our resource allocations, and that we intentionally translate it into practice? Thank you. And I would love to hear any of your thoughts or questions, but really what this presentation is to be thought-provoking, and as you go about your day, especially in the food industry, really thinking about what other sectors we can pull in, utilizing those recommendations, and again, getting intentional at our local level. Is it easier said than done? If you want to raise your hand, easier said than done, right? Is it impossible? Is this like the impossible dream? I know when I get together with healthcare, that sector, right? Many say it is so complicated and so complex that maybe you would have to disrupt the entire system and start from scratch. Well, just like your food system, no, it's possible. Excellent, Jerry. But just like your food system, no one's saying this isn't complicated or complex. And what I believe is critically important is not just to ignore, but how do we continue to put this at the forefront, especially when we look at those intentional deaths, right? And so how do we envision the redesign along with other sectors to make this a priority?
So Rita, I'm going to jump in because I think you're asking from questions and I'll plant the seed and hopefully we get these wonderful participants to also engage. First of all, thank you very much. I think you offered a lot of insights for us to reflect on. And I'd like to ask you a question because I think your desire to go from theory to practice or from talk to action, and I think that really necessitates evidence. We need to know what's going on in this, as you say, complicated, what appears to be complicated set of, in my language, relationships between from farm to fork. So from your perspective, how do you see us gathering information that supports health, but from across different, I'll say, agencies or departments? What kind of work can we support in our day-to-day work? How can we feed what we're doing to these places so we can get that bigger picture?
Thank you, Jerry. I think, also what's critically important that we also need to lean on that this isn't just an issue for the local area. And as you saw, it's an issue for the world, right? How do we galvanize? Because if the World Economic Forum, was really intentionally looking at this, right? How do we galvanize under that framework and look at who, best practices, who around the world, or even just within the US or even at a regional or even at a local area has already put not only thought behind it, but maybe has done some demonstration pilots relative to a redesign, keeping in mind those who have been made marginalized. And how do we bring those best examples forward? What I love about this series is, to some degree, it's Delaware and Maryland, right? So two significant states are dedicating themselves to really looking at that, what before you called the big easy idea. Well, how do you take that idea and then, how do you cascade it with people who have influence, right? And cross-sector and healthcare, the impact when we don't do this, we see it at a healthcare with the level of death, but also with the level of chronic disease. So how do we bring in others who, may not be intentional with the food system, but they see the consequences?
Thank you, Rita. We have a hand up, which I think John Manirakazara, you have to pronounce her name. Would you like to ask the question?
Yeah, John Manirakiza, yes. Very good presentation and a lot of information. Um, since the data show that the access is the biggest problem, um, and that those who don't have access actually don't have access to power, how do we go about making access a priority rather than we'll just write more policies that the World Economic Forum, as far as I'm concerned, they are only looking from the economic side of things, not necessarily at the health side of things. How do we actually, I'm talking from I'm working as a farmer on the community level, where we do face the issue of access and also profitability. And I just wanted to know what can we do as farmers, and also empower the people who don't have access to basically ask for it, maybe through advocacy and other things. Thanks.
Thank you, John. I think access is one of the issues. And I think, I think Maria and Jerry intentionally wanted all speakers to look at the entire food system and that map. And I would dare, Maria, I don't know, can you put up that map? Because I would say at every level, there's probably issues relative. And I believe somebody even was thinking about, they put in the chat. So Ruth put in, how do farmer subsidies play into these aspirations? Do we need a better balance, right? So it's all interconnected. And at the end of that interconnectedness, I would say, is access. Even when we look at the ability to farm our own land, right? And how does our food travel? And where does that travel? Where does our food travel to? And how does that travel impact our cost? And even when we think about, traditional farming, are we losing ground because of policy? What is occurring in the entire system? So I think what you hear about access many times when we are fortunate to get the voice of the very communities that have the most significant challenge is more from their ability to have access, but it is much more complicated and complex than just access. And Maria, I don't know if you wanted to add anything relative to the map. Oh, you're on mute, Maria.
I really do think that you said it, Rita. I mean, it's partly, locale, right? But it's also income and health and, their knowledge base about what it takes to be healthy and how that relates to nutrition and food and food safety, right? So it is, it's complex. And I think the other way to think about it is, just as in this image, we're looking at kind of, multiple, I'll just call them concentric circles of things. The same thing happens at the individual and family level, right? So there's me, and then there's me and my family, and then there's me and my extended family, and then there's me and all of those layers and my community and the environment in which that community is, and then beyond, right? And so that's also part of the complexity. And there are different organizations who are working at those different levels, right? And so you might have the food bank, for example, which is a community organization, but is all about trying to get food to individuals and families. Or the Cooperative Extension Service has an expanded foods and nutrition education program. And so that's all about working with limited resource individuals and families around making healthy food choices. So And then there's organizations that are working to change, the broader environments and the communities in which we live, or the healthcare system. And so different things are happening by different organizations at different levels. And that's partly what we're trying to explore in this series.
Exactly. And in good public health form, like public health always look at what's the root cause analysis. And I think what this map is trying to intentionally show is not only the interconnectedness, but also what's at the root of every area. If climate change is going to start impacting us, like what does that mean from a food system perspective? If our farmers are aging out and no younger farmers are coming in, what does that mean from the production of our food? And all those, right? I gave you an opportunity to think about the haves and the have-nots, largely from an access perspective, but you got to continue to do the root cause too. What's the root cause for that limited access? And even for the greater good, the impact on all of us, right? With the whole food supply chain, what has happened with our food supply chain since pandemic. So how do we mitigate? That's why I never waste a great emergency, because it tells you in real time the vulnerability of that emergency, and ours was the pandemic. But then it also gives us opportunity to rethink and mitigate relative to the multiple conditions that we are faced with. And I love Ruth. Ruth, I just wanted to bring you back here, because what I like, what you're trying to highlight is you're doing exactly what I think we all need to do. Very specific. How do farmer subsidies play into these aspirations? So, it's how do we start creatively thinking about what is in the way, what is challenging our system, and then how do we creatively think about how do we mitigate against that, and how do we advance, even with some of these challenges. And I believe our series is attempting to start to stimulate that. And then where do we go from here? And, my recommendation is let's keep thinking cross-sector. John, as you said, thinking about who does have influence, but who else do we bring to the table that will indeed see the value of this level of cross-sector engagement and advancement, inclusive of the people that many times are impacted. Now, we're all impacted, but impacted the most to the detriment.
Thank you.
Thank you.
You really got us thinking, Rita.
That's what I like to do.
At multiple levels, I think. And so thank you very much for your presentation and your insights, and sharing sort of even what's happening, nationally and locally and regionally and whatnot. And so I wanted to, share this, right? Wanted to remind you that next week we have individuals from both the Delaware and Maryland Department of Agriculture. And so they're going to be presenting, each of them kind of presenting from their own state's perspective, what information about the food system from that agricultural perspective. And so I really hope that you can join us next week at the same time, same URL. And you'll notice I put in the chat a little survey. And so we would love to hear from you. It'll take you less than 3 minutes, really, but to give us some feedback about today's session and what you're taking away from today's session. So with that, I am going to say we are finished for today's session, unless there's other questions. And I thank you so much for being with us.